Ya estoy grabando.
Okay. Hi, good morning. My name is Emily Jimenez, and with my team, Barbara Villegas, Renata Moreno, and Miranda Zamora, we're going to present you a compare and contrast reflection about illness prevention as it is a matter of individual or government responsibility. I'm going to start with my own essay that talks about how illness prevention is a substantial problem that needs to be solved, but who will do it isn't the main matter to observe. I think the one leading narration, the government, is responsible to appropriately educate their people.
So in my essay, I talk about how health is an individual responsibility. Health is a top priority and many diseases can be prevented through personal habits. While some people think that prevention is mainly the government's job, it actually starts with individual choices since lifestyle changes can greatly reduce disease risk. The government can support public health, especially for people with disabilities or limited conditions, but most prevention depends on individuals taking responsibility for their own health.
Now, in my essay, I argue that the personal decisions directly affect health and vary according to each person's lifestyle. The government provides resources, implements measures during crises, and promotes health policies, but their effectiveness depends on whether people choose and use to follow them. Using these resources with responsibility and making choices that benefit personal and collective health is essential for effective disease prevention. I believe that the disease prevention mostly depends on the individual's opinion about diseases, the choices they make, and the lifestyle they carry.
In my paper, I talk about how disease prevention falls mainly on government officials, due to the fact that they are the ones who make healthcare accessible, easy, or hard to be able to use. I believe that the government is responsible for the access that people may have, but the actual health prevention falls on families. These conditions, though, get weighted out by the influence the government has to people. As if healthcare is not accessible, people are not able to take care of themselves or their family due to either monetary purposes.
So the arguments that I use to back up my thesis, which is disease prevention mainly depends on individuals and their personal decisions, is that primary prevention aims to reduce the risk of disease before it begins by targeting risk factors in healthy individuals. So this means that diseases can be prevented with healthy habits.
I think the same. While both individuals and the government contribute to disease prevention, I think the individuals play the most decisive role. Lifestyle choices, habits, and the willing to follow medical advice are personal choices that directly affect health, as I previously mentioned. Although the government provides guidance and resources, prevention will only be effective if people choose to use these correctly.
And our arguments about government responsibility is that the individual needs an initiative from the government to get proper education about illness prevention.
Uh, Disease prevention falls on individuals and their families, but the government plays a big part on the subject due to them managing the price and accessibility of healthcare. If no one has access, the individual can't take care of themselves.
And to compare our perspective and essays, it's easy to see that we all think that action needs to be done in case to individual and government responsibility. But to compare, we gotta think who started, who needs to get that initiative from programs or education, accessibility of healthcare, but it's mainly an individual responsibility to do their actions and to get the recommendations from the government. Thank you.